and welcome to the Winner's Circle. I'm your host, Dr. Sean Hubbard. As you're aware, on the Winner's Circle, we like to take on challenges and concerns of the day. We like to talk about how to recognize them, how to diagnose them, treat them, and prevent them. But ultimately, the Winner's Circle is not about problems. It's about finding solutions. It's about the search for wellness and well-being. Here to help me do all that today, I have a colleague, Dr. Jordan Barnett. Dr. Barnett is an emergency department physician and colleague and friend.
I appreciate you having me. Thank you very much. It's a nice introduction.
Thanks for coming on. The challenge I wanted to talk about today is COVID. Now, I'm kind of framing it as a challenge, but personally, I have the feeling that we have a sense of success, the potential for success and overcoming, really victory over COVID, basically from what we've learned so far. I wonder if you...
Well, admittedly, when the stories first broke out in Wuhan and the information was trickling out, there was little information. And even the physician who identified it in China, a lot of the information that he had come across was being suppressed, and it was an unknown.
Right.
And all of a sudden, we start hearing about lockdowns and deaths, and we were pretty much feeling as if we were immune because we were a continent away. That was China.
Yes.
Here we are in the U.S.
Yes.
And all of a sudden, these cases started to trickle through, and we saw the news reports of what was happening in New York City with freezer trucks being used because of the number of deaths. And we had pictures of exhausted workers with sores on their faces from wearing the PPE. And we've come away from that. We actually have reached a point where there has been, in terms of both identification and also protection of staff, certainly a point where we don't have those same degree of bleak pictures that we did back in the early period when this hit the United States.
Very painful.
Yeah, not just the United States. I mean, look what happened to Italy.
Yes.
Look what happened in many places of Europe.
Yes.
Yeah.
Yeah, you know, there was an issue, I think, with knowing what a person would actually look like. I mean, at first we were thinking that the people that would be most affected and most obvious were people with emphysema, people with COPD and asthma. Remember back then when we thought that these are the people that are going to be showing up mostly with this problem?
It was also thought to be predominantly, well, first of all, they didn't have a clear understanding of the transmission process either.
Sure.
And what you just said, from a logical standpoint, it always makes sense that somebody with a pre-existing illness affecting that organ system would be the individual who would have the most problems.
That's right.
And then all of a sudden, these other cases were showing up, and figuring out what was going on ended up making people open their eyes and say, there's a little bit more to this.
Wow.
So,
I'm glad that we've grown from that, you know.
Yeah, well, the thing is, medicine and science is, creating hypotheses and taking a look at the data and revising hypotheses until the data fits, and then through experimentation, verifying what our hypothesis happens to be.
That's right.
And that is also one of the reasons why there was a lot of fear, I think, from this changing reports of masks. You don't need to wear a mask. Everybody needs to wear a mask. It's droplet, it's touch, because the data wasn't there.
We didn't have it.
Exactly. And so this was like with anything in science. It was a growing continuum.
That's right. And so we had this idea that it's an enemy that's invisible, and we don't know what direction it's going to come from. We had some basic ideas from what we learned from China, but then we had to learn on our own and with our own people, our own citizens in America, what people actually look like. I wanted to ask you, now that we've gotten this experience, what lets you know clinically when a patient really looks like a patient with COVID?
Well, there's several things. First of all, it's kind of helpful right now that influenza has not hit yet, which is probably a great reason for everybody to go get their flu shot. Because the problem can be that you have somebody showing up with what looks like a viral illness, and as we get into the fall, what's influenza, what's not.
Right.
On a positive note, in regards to that differentiation, the amount of influenza that's supposed to be striking is expected to be decreased because of mask wearing. So that might end up shifting. I mean, that's a current theory. And as far as what a COVID patient looks like, not everybody fits the mold.
Okay.
But in general, the picture of somebody with a fever, short of breath, cough, we use the word myalgias, meaning body aches.
Yes.
Sometimes decreased taste, sometimes some diarrhea, some belly pain, tends to fit the general mold
Yes.
of who's a COVID patient.
Yes.
Now, there are outliers again, because there are folks who come in with some unusual symptoms.
Right.
And that's where the policies of a number of institutions that anybody who's going to be admitted for observation,
Yes.
a number of hospitals have now put this generalized policy in place that everybody who's coming in gets COVID testing to pick
Sure.
those outliers out.
Sure.
But what I described is the general picture.
Okay. So everybody who comes in the hospital gets a COVID test?
Everybody who's going to be admitted,
Going to be admitted.
at least in the systems that I work for.
Sure. Okay. Okay. Now, there was a time early on, speaking of it being invisible, when it was really hard to put a camera on exactly what was happening, a light on it, because it would take a long time to get results back, even a week or so.
Yeah. We actually personally, from our work with our colleagues, there have been several colleagues that we both had spoken about before camera, who ended up, one of which ended up in an ICU at an outside institution, and it took somewhere between 5 to 7 days for results, because the turnaround time was slow. We had another colleague who had a newborn child, who, to protect his newborn child and his family, was literally living in his basement to avoid exposing his family, but couldn't go back to work because of fear of being a threat to patients and his other colleagues. So yeah, the turnaround time was prolonged. That has shortened. It's still not one of those wonderful rapid bedside tests like you can do for a pregnancy test or for a urinalysis.
Yes.
Or even for the common cold, a lot of urgent cares do influenza tests right there with point-of-care testing. Ideally, that should come, but we're not there yet.
Right. Yes. Agreed. Agreed. So, well, I do have some good news. There's a patient I saw the other day, and he had some difficulty getting up out of his chair. He's about 68 years old, and so he really sought help from his family. He called his daughter and his son just to help get out of the chair that he had been sitting in. And the daughter said, you know, you're looking kind of weak. You've also been coughing for 2 weeks. We better get that checked out. They came to the emergency department and saw you.
Saw me?
You.
I don't even remember this. Okay.
It was Tuesday, as a matter of fact. And you
this
ordered,
Tuesday?
This past Tuesday. Did you work Tuesday? Oh, well, I saw your name on the record, so.
I don't know. The days have been blurring together.
Okay. So now, anyway.
I did work Tuesday.
I saw him
Okay.
on Wednesday.
Okay.
And he was properly quarantined. He wasn't weak anymore.
Okay.
His COVID test that you ordered on Tuesday came back positive. And he's doing well, as a matter of fact.
Good.
His strength came back. He still has a bit of a cough, but he's quite strong. And but the point of that is to let you know that the COVID test that you ordered came back within 24 hours now.
That's wonderful.
And
okay.
we're able to provide the proper care. So what we were calling an invisible condition, an invisible enemy, is we have more light on it now, and we can figure it out earlier. I think we have a better handle on what's going on, to the extent that we can appreciate some degree of victory over this condition once we are really doing and practicing more of what we know.
I would add to the fact that part of that shedding light has to do with a multidisciplinary approach.
Yes.
Certainly this does involve not just any single specialty. As an ER physician, I rely heavily on, how many times have I called you wee hours of the morning saying, I'm not sure what's going on, please guide me.
Right.
And the general weakness in an elderly man can be very confusing as to what it can be.
Absolutely.
So we rely as a team to shed that light between infectious disease and pulmonary and neurology and geriatrics. You bring all those pieces together.
That's right.
And as a team approach, light gets shed.
Yes. Makes sense.
Yeah.
Makes sense. Yeah. So I think that we're making progress. COVID has been challenging, but we're understanding more about how it looks. And though there are some features of it that we can't see, I mean, we can't look at somebody and say, she's COVID positive, he's not, because some people are positive and they don't look like they are. But when we don't know if a person is COVID positive, I think that what we're doing now is assuming, especially in public, and wearing a mask.
Oh, yeah. The reality is, and we've talked about this up before camera, the probability is that a number of healthcare workers, especially in environments like mine in the ER,
Yes.
where when this ended up becoming so pervasive well, we're in the Northeast, we probably have had a number of clinicians and nurses and techs who've had asymptomatic cases.
That's right.
I shared with you that I personally have had to have 3 individual COVID tests over the past 4 weeks between some personal health care issues and also for a physical I had to take for my pilot's license.
Sure.
So, you know, the fact that here I was running into rooms with people who weren't breathing, who needed immediate interventions, sometimes with minimal PPE consisting
Yes.
just of a cloth mask or
Sure.
a face mask. It makes logical sense then how did I go through all these months and how did my nurses and my techs, with the exception of the few that we talked about, and there were a couple of others actually, remain COVID negative. The odds are I was asymptomatic with a case at some point. It would make sense.
Sure, yeah, sure.
Which is also actually one of the reasons why there's such a push. Listen, everybody wear a mask. You don't know if you've got it. You don't know if you're shedding it.
Right.
You don't know if the person behind you just started her chemotherapy for breast cancer.
Yeah, that's right. That's right. Yeah, yeah. Yeah, well, you know, I think that what has helped us, and it certainly has helped me, is just the practice of keeping moving a lot and not staying in one space. I mean, I'm a hospitalist and I see people in the hospital for, let's say, weakness. There was a time when we were not wearing, and we were instructed not to wear PPE when seeing patients if they didn't have respiratory symptoms. And so I would go and see somebody like the gentleman we were talking about who had weakness, and the concern was, does he have a new stroke? It's brand new weakness. But so I wasn't wearing a mask. But the practice of going, examining, keeping it brief, and keeping moving, having some distance, I think that was also helping. So the practices, I think, help us even when it's not just one sort of issue, you know, one mask, you know. So a mask and keeping moving, keeping our interactions brief, I think that kind of helps.
Yeah, no,
You know, some distance.
yeah, the distance is the issue. Yeah,
Sure.
the distance, and since it's predominantly respiratory, and from a contact standpoint, everything's being wiped down continuously.
Yes.
And all of us, as we start shifts, we have hand sanitizer for the keyboards, and we've got sanitizer that's being used as we wash in, wash out. And I'm very cognizant at this point in time to avoid touching my face after being in a room until I wash out, which is terrible when you get that itch on the nose that you can't get to.
It's happened to us all, right?
Yeah.
It's right. So now, has this affected you from a like personal standpoint in terms of your travel and things like that?
It's affected me on multiple levels. I mentioned having to get the COVID testing 3 times the past couple of weeks.
Okay.
And I also mentioned I was a student pilot, and I've been flying with this same gentleman for years, and I loved flying with Joe. Thing is, he's in his 70s, and I didn't want to risk being in a cockpit
Sure.
affecting a 70-year-old. I stopped flying with Joe and ended up finding another instructor who was comfortable with me.
Got it.
The flight surgeon who does my medical 3 so I can fly,
Yes.
he's in his 70s.
Okay.
He wouldn't see me unless I went to the county health department and in 24 hours came back with a document saying Jordan Barnett's COVID negative.
Perfect.
My dad, unfortunately, we buried my mother in November of this past year. And my dad's alone, he's going to be 83 this upcoming year. And I was avoiding going up to see him. He was alone in the house. I was doing Zoom calls, but he was isolated. I didn't want to run the risk
Yes.
of an elderly man with heart disease, overweight, and showing up and getting this man sick. So it took away from my family and even opportunities for personal accolades. I ended up ending up with a diploma from a program I applied for. The graduation was canceled.
Goodness.
I didn't get to see my daughter's graduation.
Oh, geez.
All this came into play because of COVID, so it's
Wow.
it's affected me personally. It's
Yeah.
affected my family personally,
Yeah.
and it's been painful.
Oh,
but At the same token,
Yeah.
I'm thankful that I'm working in an environment
Yes.
where that there is the consideration of keeping everybody safe,
Sure.
and the equipment's now being provided.
Definitely.
And yeah, that's basically what I want to share with that. Yeah.
Yeah, thank you. Thanks for
No
sharing
problem.
that. Yeah. Yeah, on the subject of making COVID more visible,
Yes.
and more tangible, I wonder if we take a break, and when we come back, if you'll help me look at a few X-rays. And,
Oh, absolutely, yeah.
just from your own perspective.
Yeah.
Because you look at more chest X-rays than I do.
We both look at radiology.
We're going to take a break
Okay.
and then come back, and we'll ask Dr. Jordan to help us out understanding what the chest X-rays look like with COVID, let's say, different types of pneumonia, and he's going to help us out with that.
Sounds good.
And then I'm going to ask you the big question, Dr. Jordan.
Okay.
We'll take a break shortly. Thank you.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. But it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, she's putting them in the same basket. Again. It's like, hello? That's where you put it last time. You were the worst at hide and go seek.
Hi, and welcome back. Welcome back to the Winner's Circle. I'm Dr. Sean, your host, and I am honored to have Dr. Jordan Barnett here as a guest. He's been educating us on his experiences as an emergency department physician managing patients that seem like they may have COVID. Thanks for coming on back.
Thanks for having me again. I appreciate it.
I wanted to ask you about one of the more controversial issues, and that
Sure.
would be mask mandates. There's some idea that if we have a new president, that we might even be having this idea that everybody's going to have to wear a mask. Do you see any benefit into that?
Well, as far as I want to avoid the political side of this, because unfortunately it's turned into a political issue. And I truly wish that what was actually going on was that there was a lead from the scientists and the infectious disease doctors.
Sure.
The real issue for the mask has to do less so for protecting yourself, but for protecting others. I had mentioned before the break, very often people have illnesses and they want to keep them quiet, not disclose it to others.
Sure.
And you have no idea when you go to the supermarket, is the lady standing behind you, is she just started her first treatment for breast cancer, got her first round of chemotherapy.
Right.
You don't know if the person next to you has some underlying disease that all they need is one more assault that would put them over the edge.
Right.
I mentioned my father, visiting him and not wearing a mask. I mean, I avoided seeing him for the first several months altogether.
Sure.
But here's a man who's somewhat debilitated.
Right.
So the purpose of the mask has more to do with, maybe I should get a little bit political, it's citizenry. It's protecting those around you.
That's okay. That makes sense.
Yeah.
I mean, you have a family.
Yeah.
And I have a family, and we have a community, and we're all involved in providing health care for our community. It makes a ton of sense.
Yeah.
And on that, speaking of community, what about our businesses? The idea of shutdowns, that's painful to do. But you have been staying busy, learning how to fly a plane, and I've been doing some of that too. But the idea of shutdowns, do you have any feelings about that?
First of all, I feel terrible for the people who are business owners. I've had this discussion numerous times. In fact, I
Yes.
got a friend who's very close to me who is a chef, and he's been affected. His business has been hurt.
Yes.
This goes back to what we were talking about before, about the people who are epidemiologists and the infectious disease doctors
Yes.
trying to get a hold of something that they did not have a clear understanding of.
Correct. Yes.
I think the idea of shutdowns, I think we're beyond the point of specifically containing the virus to a community. It's
Yes.
spread across the entire United States.
Yes.
And one of the politicians I had heard recently from a neighboring state had discussed the idea of looking for the embers of the forest fire and squashing that fire, those embers as they start to emerge.
Sure.
I think at the point that we are right now, and I'm speaking not as an epidemiologist, not as an infectious disease doctor, but as an ER physician,
Sure.
looking at the information that I'm getting from these sources
Right.
makes the most sense. So you
Yes.
discover that there's a community. Actually, they do this right now. There are some communities up in Rockville, New York.
Okay.
I think I may be saying it wrong.
Okay.
Where there was an outbreak of measles.
Okay.
So all of a sudden, what they do, they had the health department come in, and they started to isolate this to prevent the spread.
Yes.
That same philosophy would minimize damage, but would also help keep the caseload down.
Sure.
So I think it's the best answer.
Yes.
Maybe at the beginning to
Right.
say, hey, listen, this just came in from Europe into New York. This just came in from China into the California coast.
Right.
Let's lock everything down. Then
Right.
would have been effective. It
Sure.
didn't happen to that degree, and it got out of control. So I think that's a long-winded answer, but
Yeah.
I think it addresses the question.
Sure, sure. I have been considering this idea of shutdowns, and it's painful, As
Yeah.
a matter of fact, in our community, the places that we go to have dinner on a regular basis when everything is normal, I have specifically continued to order from those places.
Oh, yeah.
And pick up our food, and I always tip the people who are just answering the phone and handing our food and preparing it
Yeah.
to keep them afloat
Yeah.
during this difficult time.
Absolutely.
From a shutdown standpoint myself, shutdown sounds really bad, and it sounds horrible from a business standpoint also. But I think what it has provided personally, I like the idea more of a quiet time, or no, not quiet time, but when we take a timeout.
Okay.
Let's say a timeout, and then we talk about as a family, a team, a work group, even one person to another, take a timeout and just talk about and think about what are we going to do to keep ourselves safe, and how are we going to do well from a health perspective, an economic perspective. Let's just put some measures in place so that we can get to a point next year when it's easier, let's say,
Yeah.
with a vaccine or something.
Yeah, absolutely.
So I like a timeout.
Yeah.
You know.
Again, I agree with you. We should absolutely support every way we can the folks who have been mostly affected by these shutdowns.
Sure.
I know numerous friends who have been hurting, and what you described is what they need. Everything you can to help keep them afloat.
Right.
Yeah.
I wonder if we could look over a couple of X-rays.
Oh yeah, by all means, please.
So people will show up in your emergency department.
Oh, yeah.
Somebody has a cough. You have to distinguish between, let's say, pneumonia, flu, COVID. I know it's not easy,
Yeah.
but you look at these X-rays. I wonder if you can
Sure.
just walk me through a few and some of the hallmarks that you see.
All right. So the first X-ray up is a lot of markings. Well, a normal X-ray, you could see the sharp borders of the heart on both sides, and most of the lung is black.
Okay.
And what you're seeing in this x-ray is a heart that's slightly bigger than it should be. Typically the size of the heart doesn't take up that much space, and that's the majority of the white that you're seeing that sort of has a bag-like appearance in the center there. But all of those white markings going all the way up to the tip of the chest,
Yes.
those are blood vessels.
Goodness.
And those are blood vessels that are filled with fluid. There's a lot of fluid leaking around those blood vessels, and that's congestive heart failure.
Got it.
Actually, clinically, very often you can hear certain sounds which are confirmatory for what you're seeing on the x-ray to say, hey, this is a patient with congestive heart failure.
Got it.
Yeah.
Okay.
But again, the hallmark is all the white streaking up in the periphery, and even the heart, the shadow of the heart
Yes.
is kind of mixed into that haziness.
Kind of blurred. I did
Yeah,
see that.
yeah.
Okay. Maybe we'll look at another film.
Okay, all right. So in this patient, again, the black I described of what we want to see
Yes.
is present for the most part in both the right side of the screen and the tip of the left.
Right.
And incidentally, when you look at an x-ray, what's right is left and left is right.
Sure.
So, but if you look at the screen and look at that left lower portion,
Right.
all that white in there
Yes.
shouldn't be there. That's essentially pus.
Wow.
That's somebody with pneumonia.
Okay.
There's a little bit on the right side of the heart too,
Yes.
but it's predominantly that on the left side of the screen. I'm trying to not mess up anatomical left and right and
Right.
viewers' vision of left and right, but
Sure.
if you're looking at the screen, the left side, the left base, that haziness shouldn't be there.
And again, both of the patients that we just looked at can be coming to you and saying, I feel
can't
short
breathe.
of breath, I
Yeah.
can't breathe.
Yeah,
And okay, got
but
it.
there are other elements too to help figure out, I'm short of breath, I can't breathe.
Yes.
Going back to that first patient,
Yes.
usually there are clues. So you've got somebody with known cardiac disease.
Yes.
They have to sit up to breathe.
Yes.
Very often when you listen, you're hearing something that we call rales, which
Yes.
is bubbles of fluid that you can hear in the lungs.
Sure.
Somebody coming in with a pneumonia, typically they're a high fever. And when you're listening to the chest, you're hearing coarse breath sounds in a particular location.
Yes.
And the rest of the lungs sound clear.
Perfect.
So there are other clues that you put the pieces together and say, you know what, I'm expecting to see an x-ray with this.
Got it.
So it's not just here's one element of the puzzle.
Yes.
There are multiple pieces that come together which
Sure.
help fill in the blanks as far as the image is concerned.
You have to be a trained professional to do that.
And rely on others too. It's a team approach.
No need to be modest here,
Okay.
Dr. Barnett. Let's take another one.
Okay. So again, as I explained before, typically when you're looking at an x-ray, this is nice because you could see pretty much the sharp heart borders.
Yes.
And as I described, in a normal chest x-ray, everything outside that in the lung fields
Yes.
is mostly black. But if you take a look again, there's some haziness, which are very fine streaks
Sure.
in the lungs. We call that a pneumonitis. It's diffuse.
Got it.
And here too, there'll be some clues as far as clinical being supported by the x-ray.
Right.
So typically with a pneumonitis, it might look more like a flu. You might have
Yes.
somebody coming in with some fevers, a runny nose, maybe a sore throat, some
Yes.
body aches, and the lung sounds are kind of crackly or coarse everywhere and not specific. And again, the physical examination in conjunction with the images put the pieces together and say, it's probably a pneumonitis.
Sure.
And admittedly, the radiologists also, when they look at these films,
Right.
they are giving their expertise, but very often they will also put a disclaimer that they can't rule out other pathology.
Right.
Further supporting what I'm saying, that's mostly a jigsaw puzzle where you
Right.
put all the pieces together
Sure.
and you come up with a confirmatory diagnosis.
Makes sense.
Yeah.
Makes sense. Yes. Yes. So I should reiterate that when the patient comes in and they have a complaint, and then you're going through the history, and then you do your examination, you're able to guess with all of this information and put together what we call a clinical diagnosis.
Yeah.
And then we will order these tests, and that'll get us further down the pike in terms of understanding.
Yeah, one of the things that we're trained to do from medical students onward was
Yes.
to create what's called a differential.
Sure.
So a differential means that the car comes into the auto shop, the car doesn't start.
Yes.
So you start to make a list. Well, is there gas in the tank? Is the battery charged?
Right.
Do I have power you put the pieces together and you start ruling things out.
Sure.
Until you come up to the conclusion that, oh my God, I never put gas in the engine.
How about that?
So it's the same type of process.
Right.
So somebody comes in with a fever, they're short of breath, they've got a cough.
Right.
You come up with a list, well, what can this be?
Sure.
And then you start looking at other data and you start knocking off things from the list until you come up with a plausible solution, and additional testing ideally will confirm or negate what you came up with.
Perfect.
And then you go back and revise your hypothesis.
Sure.
And that's also one of the reasons why we rely very heavily on each other.
Yes.
Medical care today is pretty much a team approach.
Very collaborative.
Yeah.
Let's take one more image.
Sure. All right.
So they're all coming in complaining of breathing problems, short of breath or cough, and
Yeah, so this is where some of the confusion does come in.
Yes.
Because if we look at this film and the one before it, it looks very similar in many regards. But if you take a look, there's some patchy, we could use the word opacities, like circles
Yes.
in different fields.
Right.
And those little patches are the very minor things that can differentiate when this is a COVID pneumonia versus a viral pneumonia.
Sure.
Versus what we saw in the film before that, where we just had
Right.
the left hand of the screen that the viewers were looking at with
Yes.
that white patch in the base there.
Right. Got it. Okay, got it.
Yeah.
So that when we have these images, again, these conditions become less invisible.
Yes, absolutely.
And now we're starting to see what's actually happening in the lungs themselves. Yeah, that's very
Yeah.
helpful. Well, thank you so much for that.
Oh,
Now,
my pleasure.
And now the big question is, we've heard that what you recommend for patients to be clear of conditions like COVID. We have these principles and these practices, but how do you keep yourself balanced? I know you have some hobbies and things like that you like to do.
How do I keep myself balanced? It's a combination. And safe.
Yeah.
The safety has to do what we talked about. We
Sure.
wash in, we wash out.
Right.
We wear masks. We also, whenever we have family or friends who are sick, who potentially have COVID, we make certain they're looked after. We have touchless delivery of Grubhub, for instance, or foods left outside,
Sure.
so we're not spreading illness.
Right.
As far as keeping balance, I have a number of hobbies.
You have some family at home that
I have a wife
you
at
look
home,
after?
and I have a group of close friends who've
Sure.
looked after me as well. In regards to other things, I have other outlets too.
Right.
For me, the act of going for the flying lessons has less to do with the fact that after 2 years, I still can't land a plane in a crosswind. That has nothing to do with it. I enjoy the time with the people who are at the airport.
Yes.
And my instructor in particular, Kevin Rondeau, I think he's phenomenal. He actually is military
Yes.
and serves at the McGuire. He's a fantastic human being, and I really appreciate what he's doing to serve, but he also grounds me enormously. I can't say enough how much I appreciate this man.
Excellent, excellent. So what I hear you describing now is the healthiness that you get from your community.
Absolutely.
And excellent. Well, thanks for sharing that.
My pleasure.
Yeah,
Thank
thanks
you.
for sharing all of the expertise.
Oh,
and all of
thank
your
you for having me
experience.
here. This was
Yeah,
fantastic.
Yeah, thank you, thank you.
Yeah.
And thank you all for watching and sharing the Winner Circle, and thank you for viewing and your participation. I hope that you have gleaned from Dr. Barnett and our exchange that we're making some progress. We've made a lot of progress, as a matter of fact, in understanding COVID. At first it was more invisible. Now it's less invisible. We have some handles on it. We can see it in various aspects. We can diagnose it more quickly than we could before. We can get lab results back more quickly, particularly for patients that are very ill, the patients that need it the most. So if we practice a lot more of what we really understand, we can definitely experience victory over COVID. Thank you so much again for joining. We'll look for you next week this time at Monday at 2 o'clock or Tuesday, 6 o'clock p.m. right here at RVN TV. Thanks for joining, guys. Until
Thanks for
then,
having me.
keep winning.